And today, New York City starts enforcing its indoor vaccine requirement. The mandate states indoor businesses like theaters, restaurants, and gyms have to require proof of vaccination for customers to enter. It also means staff at those locations have to be vaccinated. Infectious disease specialist at South Shore Health and ABC News medical contributor Dr. Todd Ellerin is here with more on this. Dr. Ellerin, thanks for being here. What do you make of this policy, and what kind of an impact do you think it'll have?
You know, Diane, I think this policy is really important. Why? Because we have to be more aggressive right now rather than less aggressive. Delta, the most contagious variant to date. Winter's coming. We're going to be spending more time indoors. Half the country's still unvaccinated. A lot of kids can't get vaccinated, those that are under 12 at this point. So for all of these reasons, I think, what the governor is issuing is very important. We have to double down right now.
Is it not enough if someone doesn't feel comfortable getting vaccinated for them to do masking and testing and take the other precautions?
These layers of safety that you just mentioned are additionally very important right now. But the vaccine is, it's like a molecular shield for us, and we need that given how fierce Delta will likely be this coming winter. So the layers are important. Masking indoors is essential as well. We can't just have one point of defense. We need multiple points, but the vaccine is still critical at this point.
Now, millions of kids in New York City also started school today. It's the largest school district in the country. So what are you looking out for as the school year starts here?
Well, what we've seen really around the world when schools are opening, of course, we are seeing more cases. But remember, just because we see more cases in kids doesn't mean that those transmissions are occurring in schools. In fact, if we see that most kids are masking while they're in school, then they're most likely, if they get infected, to be infected outside of the classrooms, in the community where there's community transmission. Diane, we know in places where there's community transmission that we're going to see more cases. But as long as we maximize the number of kids vaccinated, and remember, when you're vaccinating your adolescents, you're also protecting the younger siblings that are in the household that can't get vaccinated at this point. So vaccine, indoor masking, that will help decrease the number of cases. But of course, as school opens up, we know we're going to see more cases.
And the FDA is making it clear it will not cut corners, and it's cautioning parents not to try to get kids under 12 vaccinated ahead of that pending FDA authorization. So what goes into that, and when do you think we'll see kids under 12 eligible?
What goes into the FDA's examination is an incredible lens of safety. Safety first. Remember, kids, while we're hearing about more kids getting infected, and of course there's even an increase in hospitalizations, kids ultimately do very well. So before they're going to authorize a vaccine in that 5 to 11 age range, they're going to really make sure that it's as safe as it has been in adults and the older adolescents. So they will not cut corners. When you hear the FDA give that stamp of authorization, you can trust it. And I'm expecting this before the end of the year.
All right. And according to the American Academy of Pediatrics and the Children's Hospital Association, we are now at the highest number of weekly pediatric cases on record since the pandemic started. So how do we get those numbers down, especially with the school year now underway for most, if not all, of the country?
Right. I mean, again, I think it takes those layers of safety that we talked about before. But we expect Delta is that contagious. Remember, there's 1,000 times more virus with this variant than in prior variants. So we know we're going to see more contagion, even in fully vaccinated kids. The important thing to remember is that kids overall do really well. But to maximize safety, we know what we have to do. We just have to roll up their sleeves as soon as the 11 and under get authorized this winter. I really urge parents to take their kids and get the vaccine as soon as possible.
All right, Dr. Todd Ellerin, we appreciate it as always. Thank you.
You bet, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.